It's moving swiftly. People are warned. It's thriving on rapid movement. Coughing, sneezing, spitting will not be tolerated in this theater. If you want to ride mass transit, wear a mask. Schools are closing. Church services cancelled. There is a shortage of doctors and nurses. Business is empty. The mail piles up. Garbage rots in the streets. Dead bodies wait for burial. Quarantines imposed. No one knew it was a virus. We now know it as H1N1. That was 1918. In April 2009, it moved swiftly again, addicted to rapid moves from person to person. Health authorities closed the museums. Elementary schools are shut down. Universities closed. People urged to avoid movie theaters and shaking hands. One of the largest cities in the world slows in its path. Human immune systems in the young and healthy are working overtime to manufacture antibodies. We were quickly learning once again about pandemic influenza, its symptoms, prevention, and treatment. This is the story about one type of infectious disease and what you can do to protect yourself, employees, visitors, and your zoological collection. Disease surveillance protects you and your animals. This presentation will provide useful information to help you investigate suspected cases of infectious influenza, report it to the proper authorities, and manage an outbreak. This information will enable you to prevent the spread of this disease and ensure a healthy collection. The number of communicable diseases and the re-emergence of infectious diseases thought to be under control has been increasing over the past 10 years. Over 70% of these diseases originated in animal species or can be passed between animals and humans. The United States Department of Agriculture is particularly concerned about a number of foreign animal diseases that could be introduced to the United States through trade, legal or illegal, bioterrorism, or unintentionally through travel. These foreign animal diseases could cause widespread disruption in agriculture and trade. The zoo and exotic animal community is also concerned that these diseases could spread through their collections, many of which include endangered species. Disease surveillance is more important than ever. Surveillance has three distinct elements: investigation, reporting, and management. All zoos keep records on a daily basis on the behavior, health, and welfare of their collection animals. This record keeping tends to vary among institutions, including differences in what triggers a call for a veterinary examination. There can also be differences between keepers in the type of data they record. Organized surveillance systems have been very important to the human medical community and to agricultural animals for decades. But it is only recently that the idea for organized surveillance programs for zoo and exotic animal collections has emerged. In addition to the health of the collection animals, there is a concern that staff and visitors can not only become infected themselves, but in some cases could actually infect the animals. The possibility of the spread of one of these foreign animal diseases from a zoo to a farm is of great concern. According to the Centers for Disease Control, surveillance is the systematic collection, analysis, and interpretation of outcome-specific data essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of these data to those who need to know. There are several forms of surveillance. Surveillance is more intensive than simple monitoring and can be passive, active, or syndromic. Passive surveillance is the examination and testing of only clinically affected cases or sick individuals. Active surveillance is the examination and testing of normal individuals in a population. It may also include testing in routine post-mortem examinations. Active surveillance is needed to detect subclinical cases and healthy carriers of the disease and may show a more accurate portrayal of the burden of the disease on the populations. Syndromic surveillance systems use health-related data that precede diagnosis, such as a set of characteristic symptoms, a decrease of productivity in farm animals, an increase in the population of individuals showing a particular set of disease symptoms, or even the increased purchase of certain medications. This information can signal the probability of a case of an exotic disease or an outbreak that warrants further investigation. Increasingly, the veterinary community has started to use similar systems to monitor farm animals and companion animals. Facilities that care for wildlife have been very involved in foreign animal disease surveillance programs and outbreaks. Some of these, such as the outbreak of exotic Newcastle disease in California and foot and mouth disease in the United Kingdom, were thankfully prevented from spreading to zoos due to enhanced biosecurity. Another example is avian influenza, which was recently detected in European zoos. The most famous incident where zoos were integral to diagnosing a foreign animal disease was the 1999 outbreak of West Nile virus in North America. The disease was first diagnosed by a veterinary pathologist after examining dead crows on the zoo property. This diagnosis preceded the recognition of the virus in humans. Disease surveillance for foreign animal diseases has led to the development of precautions that need to be taken at a zoo or exotic animal facility. The degree of precautions and changes will depend on the proximity of a facility to a known outbreak, whether or not the disease has been demonstrated to have infected any of the collection animals, and the nature of the disease. Biosecurity protocols may be changed, and staff may be instructed to increase the level of personal protective equipment needed. In the most severe circumstances, areas of the zoo or even the whole facility may be quarantined, in which case staff roles may change. In this training course, we will concentrate on avian influenza as it demonstrates a significant threat to zoological facilities.